Hello, I'm Jim Rice, Project Director of the new Leadership, Management, and Governance project supported by the United States Agency for International Development. We'd like to invite you to explore a series of video clips that will be provided from our staff and from frontline workers across the world. These video clips will illustrate some of the messages we've found important as we've been building the evidence that shows the substantial contributions that leadership, management, and governance makes to health system strengthening and, in turn, the most important goal of all, enhanced health outcomes. Our approach to these video clips was informed by a question raised some time ago by a physician in South Africa. He asked, what is the evidence that shows a real link between leadership and management and governance with health system strengthening and, in turn, health outcomes? What we've found in our work with the development of these training programs and actually field testing and field engagement with frontline health workers is the evidence is becoming very clear that this kind of investment in leadership and management and development really does yield substantial improvements. This project is really looking at the critical need that these often clinical physicians, nurses, other leaders that are thrown into their leadership roles without a great deal of support and developmental training materials, and our program is making those available to you. We'll be looking at the development of more women moving into leadership and governing roles and the kinds of skills and competencies and confidence they will need to be effective in the years ahead. Our approach is guided by and informed by the experiences of our staff and advisors at the Management Sciences for Health. Management Sciences for Health is a 40-year-old organization dedicated to saving lives and improving the health of some of the world's poorest and most vulnerable populations. We also have the privilege of working with 5 very well-respected organizations to develop our approach. We have the Yale Global Health Leadership Institute. We have AMREF based in Africa, which is a very respected system and network of health training and leadership programming activities. Joining us to look at the evidence base for this contribution for leadership and governance for better health outcomes is the School of Public Health from Johns Hopkins University. We also have a relationship with the International Planned Parenthood Foundation and their network of over 160 member associations that will help us carry the message forward about the value of greater activities in leadership and governance for better health outcomes. And we also have a relationship with Medic Mobile, which has been innovating in the use of cell phones and related digital tools to move knowledge into the palm of the hands of these leaders and governance folks. So we hope that these video clips of both our staff and frontline workers will be of interest to you. We encourage you to join us in this journey to champion more effective leadership and governance for health outcomes. Thanks so much for your interest.